been working with Fox for 3 years now, and actually started with one of the Vitality communities down in Spring Hill, and just excited to be here today and to share a little bit about what we do and our experience and time with the staff and the residents in the Vitality communities.
Wonderful. So can you tell us a little bit about who Fox Rehab is? Absolutely.
So Fox Rehabilitation is a private practice that provides outpatient services to older adults in their homes. So Fox is here to really just help the residents achieve their best life possible, and that's through physical and occupational therapy and speech language pathology. Our slogan is "Be stronger, live better, longer." And we were started by physical therapist Dr. Tim Fox. So our founder, he started us 22 years ago in New Jersey, and since then we've grown to nearly 2,000 clinicians practicing across 20 different states.
That's awesome. Where all are you located?
So you can see a map right there, and there's a little map showing all the different states that we currently practice in. And then as far as specifically with the Vitality communities, we're located in all of the Middle Tennessee Vitality communities, and allowing convenient access for all the residents with an office located right in each of the communities.
And what services do you guys provide?
So physical therapy, occupational, and speech therapy. Additionally, having our team on site, we're able to collaborate with the skilled nursing, with the nursing team at the senior living community. Fox clinicians are accessible for on-site fall risk screening. When indicated and used properly, the screens will allow the clinicians to identify risk, intervene, and prevent or reverse functional decline. And this is a true proactive approach to therapy. So this allows our team to identify somebody that might be at risk prior to them having a fall or going out to the hospitalization, as opposed to a reactive approach where we're waiting to do the therapy after they have a fall or some sort of medical condition that results in hospitalization.
That's great. So with regard to our communities that you all are in, we've got Maristona Franklin, Maristona Providence, which is located in Mount Juliet, Maybell Carter Senior Living, which is in Madison, Traditions of Mill Creek in Brentwood, Traditions of Spring Hill in Spring Hill, and Traditions of Smyrna in Smyrna. And we are now going to invite some very special guest speakers. Danny Phillips is our Executive Director for our Maristona Providence location, and he has a very special guest, Miss Shirley, here to discuss her experience with Fox Health and Rehab. Danny, you're on mute. Let me unmute you. Yep, working on it.
Thank you, Dresden. So I'm very excited to introduce Miss Shirley, and she's going to tell us about her experience that she's had with Fox. And we'll go right here. There you go, Miss Shirley, and take it away.
I've been here at Providence for a year, and I have had experiences of really falling or unbalancing, and thanks to Fox, they have made all the difference. They have, Brandon has worked with me and taught me how to catch myself or think before I walk. He taught me how I was going, kind of walking over one leg to the other one, and that was really a problem. And they've had an awful lot of patience with me, and I have fallen quite a bit. And now I have more confidence. I think before I walk, and some people might think that's silly, but it's not. It can save you going to the hospital or going through quite a bit of falls or hurts. And then I've got OT, and they've helped me with my hands, and they work with my arms, and little things that you wouldn't even think about. And I have learned how to write my name and all again, and I have the strength and have enough confidence in myself now that I can take care of myself. With Brandon and and the crew that's here. I can take care of myself. I have my own apartment. I take care of it. Of course, housekeeping comes in once a week, but I basically take care of myself. I have a roller walker that I use. And Brandon seems to think that I might can use a cane someday if I'll keep listening and doing the way they're teaching us. And I just thank them, and I thank Mary Stone for the help and the way they've really shown me love and caring. And it's not just a job to y'all at all. And that's how it is here. And it's a wonderful place to stay and live. And thank you.
Thank you, Miss Shirley.
Thank y'all.
So, Brandon, with that, obviously she's shared with us the benefit of having Fox in our communities, but in your opinion, what is the value of having Fox in our communities?
Absolutely. And it goes back to talking about that proactive approach to therapy. Having that proactive approach allows us to kind of identify somebody that might be at risk. And you know, we have a saying that, you know, somebody can be medically well, but functionally sick. So you can be medically well, you know, you can be in good condition that way, but functionally you might be having difficulty with walking or getting up from a chair or, you know, just getting around your apartment. And those are the things that actually put you at risk for having a fall or going out to the hospital. And so one of the things that we looked at is we reached out to a group called Optum, an independent third party, and just had them study and look at Medicare beneficiaries to see, you know, how are those that are receiving Fox services compared to those that are not receiving Fox therapy services. So they looked at data for 800,000 Medicare beneficiaries, and they compared to those that received Fox rehab services to those that didn't, and found that there was a 41% lower hospitalization rate in those that received Fox rehab services. And that's huge, especially when we're talking with this older adult population. One fall, one hospitalization is really all it takes to kind of go down that slippery slope that we don't want to go. And so keeping the residents aging in place and keeping them in the community and safe is really our goal and our purpose. And you know, we have the data to back that up, that's something that we can actually do in the community.
That's great. So when you're working with our residents, do you work with those that have dementia?
Absolutely. You know, no medical condition and you know, cognitive impairment is a limitation for having any type of physical or occupational speech therapy. And in fact, evidence has shown that regular therapeutic exercise has been proven effective in lowering the rates of mental deterioration in people with Alzheimer's and dementia. And one of the things that we found, not necessarily Fox, but you know, those residents that have some sort of cognitive impairment typically are functioning at a level below what they could truly function at. By having the physical therapy, occupational therapy, or speech language pathology, we can actually get them to function at a higher level and be able to do things that they might not have been able to do prior to that.
That's great. So I know this question has come up a lot, especially when I've been helping families find a retirement community, especially in ours. What kind of insurances do you guys accept?
Absolutely. So the insurance world is definitely a tricky thing to navigate nowadays. And it really, the true answer is it depends. You know, every insurance plan is different as far as what's in network, what's out of network. But I can tell you most insurance plans including Medicare, Medicare Advantage plans, and then private insurers have some form of outpatient therapy benefits. Prior to us starting anyone on therapy, we're going to verify their benefits. We'll relay them to the patient or to their power of attorney, and then we'll make sure that we have that consent prior to getting started with treatment. For anyone that without coverage, Fox will definitely work with them to help set up an individualized payment plan to help accommodate their needs. So we definitely have some options of ways of working with everyone as far as within their means and their insurance plans. But individually, yes, we do have to kind of verify everyone's insurance and understand what their benefits are.
Okay. And how do I know if I need it or if if my loved one needs some therapy?
Great question. So first thing that you should do is that you should discuss your situation with your physician. But some common signs that might indicate that you would need physical therapy or occupational therapy or speech language pathology, if you've had a fall in the past 6 months, if you've had a recent hospitalization, if you have any fear or worry of falling, if you even just have some unsteadiness while you're walking, pain or weakness is a common thing too. What about if you get tired or short of breath or have difficulty doing something that was maybe a once simple activity or task, but now it's a little bit more troublesome to do. And it can be just something as simple as just getting dressed or bathing, getting in and out of the shower. Also, if you have to rely more on your family or caregivers for assistance, part of our goal is to restore independence, and it's never fun to have to ask for help or assistance for things. So that's definitely something that we could help out with. Another thing could be such as difficulty chewing or swallowing. That might be a good indicator for somebody that would benefit from speech language pathology services. Coughing when eating or drinking. So after you swallow, if you have to cough or you're choking on that. Struggling to talk or have conversation. Sometimes people just feel like that they can't find the words, or they have difficulty talking, or their voice isn't loud enough. And then feeling confused or having trouble remembering.
Great, thank you.
Mm-hmm.
And so now I'm a resident with a Vitality community. How do I get going?
Great question. So a couple different ways. You can talk directly to the nursing team in that community if you're a resident, and they can come let us know. Or we have an office in every single one of the communities, so you can swing on down to the office and speak directly to one of our clinicians. First steps is that we do have to get a signed order from your physician or nurse practitioner, and so we can work with you and your family to make sure that we get the orders and get everything as far as the insurance and stuff verified. But the simple answer is, come down and say hi to our team, or reach out to any one of the team members at your community and just let them know. And we'll be glad to come chat with you and talk to you about how that can happen.
Perfect. And I'd like to interject there too, that most of our communities, we do have a service coming into our communities that allow you to sign up either primarily or secondarily with a nurse practitioner, so they can work in tandem with Fox Rehab. So what are the steps that Fox clinicians are taking to keep our residents safe from COVID? That's the big question.
Big question, and super important right now, because we do want to do our part to help flatten the curve and keep all those loved ones safe in the community. We don't want anyone to have to go out to the hospital, because they might have gotten sick or putting them at risk. So all of our clinicians are going through the same screening process that the staff members are going through in each of the communities. So having our temperature checked, oxygen saturations checked, going through all the same questionnaires, making sure that, what interactions we've had over the past 14 days, if we've been around anyone that's had any COVID-like symptoms, and refraining from entering the communities then. When our clinicians are treating and interacting with any of the residents, they are required, as you can see, wearing a face mask and some sort of face shield or goggles. And this is just a way to kind of help protect any spreading of droplets. And we're also offering face masks to any patients that we're seeing, if it's something that they can tolerate wearing. And then in addition, we are really working to limit what clinicians are going into what communities, and trying to keep that to a small number so that we're minimizing any exposure risk. So limited number of clinicians in a limited number of communities.
That's great. And then, so in continuing the conversation about COVID, what can we do to help stay healthy during COVID?
Absolutely. And this has been a hot topic because a lot of people have been confined to a small space in their home and out of your normal routine. So finding anything or any ways that we can do to stay healthy and stay active is important. And not just physically, but also mentally and spiritually and socially are all important too. So when talking about staying healthy, we want to make sure that we're thinking about all those different branches of health. First off, if you're listening to this and you have an older adult that's a family member that's living alone, be sure to have regular check-ins with them, just for their safety. You want to make sure that something didn't happen to them, and you're not able to hear from them, or if they're not able to communicate. So make sure that you're doing a regular part of checking in with them. Also, scheduling regular Zooms or Skypes or FaceTime calls with them, whether it's with you or other various family members. Since we're not able to get out and see each other, just having that face-to-face interaction through a platform like this can help them stay connected and give them that social interaction that is important. Another helpful tip is trying to maintain a regular routine. I can tell you that I'm sure a lot of people have experienced this, but your routine just gets thrown off whenever you're not doing, whether you're not going out to work, or you're not going to the grocery store, or you're just not doing the same stuff, meeting up with the same people that you used to. Maintaining a regular routine is helpful for keeping your stress levels low. It's helpful for just maintaining, just overall mental health as well too. So make sure that you're trying to get to bed at a regular time, eating meals at your normal hours. Try not to eat meals or eat food when it's not mealtime. That's important as well too. In addition to that, you also want to try to limit your TV time. Instead, try to do things that might cognitively challenge you, such as playing games, jigsaw puzzles, word search, or crossword puzzles. Anything to kind of help stimulate your mind as opposed to just watching TV. And then in addition to that, you can also try some relaxation strategies to help reduce stress, because we all know that there's a little bit of extra added stress during this time period.
Great, thank you. All right, so excuse me. Now we're going to take it over to Anna Kate. Am I on mute?
No, we got some more tips actually.
Oh, I'm so sorry.
Nope, you're okay.
Here.
Perfect, awesome. So because we might be spending a little bit more time in the home, we also want to make sure that your home environment is safe. One of the most common things that we see for older adults is a fall. So 1 in 4 older adults is going to experience a fall. And the biggest risk factor is your environment. So we want to make sure that the home environment is safe. And the great thing about being in a senior living community is that environment is already set up for safety. Unfortunately, some people's homes aren't always the most safe environment. So we got to take steps to make sure that that's a safe environment. Biggest thing is minimize clutter, keep walkways clear. If you're using something, make sure that you put it back where you got it from. Don't just lay it down on the floor in front of the recliner, or set it in front of the couch where whenever you get up, you're going to trip over it. Throw rugs. Ideally, we want to remove any throw rugs if possible. We really don't want them there causing somebody that they could trip over it. But if we have to keep it there, we can get something such as like a double-sided carpet tape to prevent them from slipping or rolling up so that they're not going to trip over it. Another thing that's important is lighting. A lot of people don't realize this, but when lighting is low or at nighttime when you can't see at all, you're actually at an increased risk for falling, because you're going to trip over things, you can get disoriented. So make sure that you have adequate light, whether it's in your living room, or you can install night lights in the bedroom or the bathroom if you have to get up in the middle of the night. So make sure that you're safe there. And then just another easy tip is keep frequently used items easily accessible. If it's something that you're using a lot throughout the day, you want to make sure it's in an easily accessible place. You don't want it to be somewhere where you have to reach up high to get it or bend down low. That's putting you at an increased risk for having a fall. Now, I think we have one more slide on some tips.
Yes.
Great. And as a physical therapist, I couldn't get off this call without having some tips on exercise, right? So regular physical activity. How do we stay active, physically active during COVID? And just to kind of give you an idea there, so the ACSM guidelines for older adults recommends 150 minutes of exercise per week. So 150 minutes is actually a good amount of time, which I believe most people are probably not doing on a consistent basis. So exercise intensity is going to be specific to that individual. So 150 minutes, it really should be about a moderately intense exercise, but it's specific to that each individual. So somebody that does walking every day at a average pace, that might not be a moderately intense exercise for them. They might need to bump it up to a brisker pace to get a moderately intense. And a moderately intense is defined as somebody that's experiencing periods of breathlessness. If it's somebody that's relatively sedentary and hasn't done much physical activity over the last couple of weeks or months, just getting up and down out of their chair, walking around their house might actually be a moderately intense exercise. So it really depends on the individual. And as far as any exercise, make sure it's appropriate and safe for you. But just some different examples, walking outside, if it's safe. I know it's starting to cool off a little bit here for us in Middle Tennessee, so it's a little bit more bearable to get outside. But obviously you wanna make sure that you can social distance yourself when you're going outside. And some ways that you can maybe increase the intensity is you can change your pace. So maybe walking at a brisker pace, or adding in some hills and elevation to give yourself a little bit more of a challenge. Going up and down stairs if you have it. And if this is something that obviously we want to make sure that you're safe, but stairs can definitely be an exercise that you can do inside your house. Just make sure that you're holding on to a rail. Getting up and down from a chair, just repeated standing up and sitting down. You'd be surprised how hard that actually can be. And it's a great functional activity because it's something that we have to do all the time. You have to get up from a chair, you have to get up from a toilet. So it's a great functional exercise that can be incorporated in almost any position or in any room. And then there's various exercises that you can do lying down, sitting, or standing exercises that can work on different upper and lower body strengthening. And the big thing here is really trying to find ways to get creative with different household objects to use for weights or resistance. A lot of times we see now is people use like soup cans or water bottles or milk jugs to fill up just to kind of give themselves a little bit of a resistance if they don't have access to dumbbells. And then another little tip, I know we said to limit your TV watching, but you know, obviously there might be times that you just, you know, can't resist watching it. Maybe during those commercial breaks, you can just get up and do a little bit of exercise during those 2 to 3 minutes, you know, when the commercials are on. So just a way to kind of help keep ourselves moving, stay healthy. And hopefully these are some good tips that will keep you emotionally and spiritually involved as well too.
That's great. And so we have another special guest here, Anna Kate, one of our therapists, with Miss Sandra over at Traditions of Spring Hill. And so Anna Kate, let me unmute you.
Hello, everybody. I'm Anna Kate Stone. I'm one of the occupational therapists with Fox, and I've been with Fox for 3 years now, just like Brandon. And this is Sandra. We've been working with her since February of this year. And of course, you know, in March, COVID happened. So we had a little bit of a break there, but Sandra did not stop. She continued on walking and exercising on her own. So then when we came back, she was doing great, and we've continued on. So I'll let you tell a little bit about when you moved here and started with us.
Well, it's a long story. She said, I've been here 7 months, and you can't beat these girls. These girls, they're the smartest 3 I've ever seen in my life. And they just take care of me and boss me. and of course, I do what they tell me to do. But they know what I need. Like this morning, I've got a knee messed up, and she worked on my knee, and now I can't tell it's even hurting. So I'm glad I'm here. And like she said, when I come here, I couldn't walk at all. And they just tried and tried and tried, and I can walk. Not perfect, but I can walk. Mm-hmm. And I just think it's nothing like them. I look forward for the days that it's my day. Well, I do it every day, but I have 2 different girls. And I just look forward for the days of coming down to therapy. And it's wonderful. I don't know what I still wouldn't be walking if I hadn't come here. So I just keep trying. That's all I can do. Just keep trying. Mm-hmm. So that's about all I got to say.
Thank you.
Thank you so much, Sandra. We appreciate you very much. All right. Well, we just want to thank everybody so much for their time and attention today and for participating, and to our very special guests, Shirley and Sandra, for joining us today and sharing your story. We're happy that you guys have made such great strides in what you do every day. And thank you so much to Brandon and your team for everything you do for our residents every day. And this has certainly been informative to the team members, I'm assuming, on the call today. And if there's anything that we can do for you guys, please don't hesitate to let us know. We are here for you regardless of whether or not you're living in one of our communities. We're here to provide a solution for you. And here at the very end, we've got Brandon's contact info, should you need it, to reach out to him and ask any additional questions that you may have.